further questions. Thank you all very much. We're going to go to the panel in opposition now. Mark Miller, John Favazza, Patrick Connolly, Michael Johansson, Keith Rawlings, and Mike Goscinski. 6, we're going to need the same number of chairs up there, so just leave the chairs and we will load everybody in. I see 5. I called 6, so that's fine. If there's somebody missing.
I don't think so.
Okay, that's fine. Happy to start. Whoever, Mr. Favazza, go ahead.
Thank you, Mr. Chairman, members of the committee. John Favazza from Manus Cannon Associates. I'm here today on behalf of the Global Health and Fitness Association. We're in opposition to Senate Bill 291. I'm joined by Mike Goscinski from the association, Keith Rawlings from the Arena Club in Bel Air, Mark Miller from Merit, and Mike Johansson from the Rifkin firm. Our members are here today. They're going to go through their commitment to creating healthier communities, increasing access to physical activity, and we just need to tell you how this bill is going to threaten our ability to continue to do so. Our facilities are primarily adult-oriented facilities. They're membership facilities. There's options for the consumers to come in. They take a tour. You get to talk to the staff, you know, and get a feel for this facility that you are entering into a membership agreement with, right? This is not a trampoline park that mom and child are walking into cold for the first time and, you know, have a liability agreement thrown in front of them in a place that they've never been before. We do have an amendment, as was mentioned by the prior panel, to address our concerns. Sellers of health care services have been regulated by the Consumer Protection Division of the Attorney General for 40 years. They look at our contracts. They look at the terms of the agreement. If there's upfront payments, we can be bonded. There's contract renewal. All of these issues are filed with the AG's office, and you know, our amendment would say that for these healthcare services or health club services entities that do this, they would be exempt from this bill. Trampoline parks do not register with the Office of the Attorney General for under that program. Finally, this is a very broad bill. There's defined terms and exemptions that are frankly circular. There's undefined terms in this bill that are defined in other sections of the code, and the scope and intent is, frankly, it's confusing. You know, one example I can talk about is commercial. There was a lot of talk from the prior panel about these agreements are void against public policy in every instance. Well, guess what? This bill exempts all kinds of agreements from the scope of this bill. This bill does not outlaw liability waivers. It picks some and exempts others. It says in this one circular definition, I won't go through all of them, but recreational facility means a commercial or recreational facility. That doesn't really help me understand what a recreational facility is. So commercial must have meaning. So that must mean someone's being exempt from it. Some place that you are going to visit, some place you're sending your child, some place you are going to do some sort of recreational activity that isn't commercial, but waivers are okay in that instance. Thank you, Mr. Chairman. We appreciate the opportunity to testify today. I'll turn it over to Mike Goscinski.
Mr. Chairman. Mr. Chairman.
Don't touch it.
Mr. Chairman, members of the committee, my name is Mike Goscinski. I'm the Vice President of Government Affairs for the Global Health and Fitness Association, and I urge your opposition to this bill as currently written, eliminating the ability for small and medium-sized businesses to obtain insurance and to operate in the state. As written, the legislation puts the industry at risk of unrestricted litigation exposure and opens the door for frivolous sue and settle actions, ultimately leading to increased operating costs and putting upward pressure on affordable access to physical activity, which, as you know, significantly benefits mental and physical health of the state. Maryland health clubs and studios are diverse as the communities they serve, ranging from small studios and low-cost national chains to premium regional and national brands. Statewide, some 700 facilities serve more than 1.1 million residents and employ nearly 30,000 Marylanders. Many are coaches, trainers, class leaders who work part-time during school for extra family income or to support career passion. Our members appreciate the bill's intent of protecting safety and are good actors in this, providing safe environments for consumers to pursue a healthy lifestyle. Unfortunately, the bill does not take into account private membership organizations that establish an acknowledgement of risk, are not open to the general public for free use, or do not offer the types of use referenced by earlier testimony or in earliest hearings. Further, the bill exempts these activities on government property, which is unfair given the wide array of gym and studio-type facilities and classes offered by local governments across the state. Enactment of this bill without revision would cause small and independent clubs to close or require price increases, making their health benefits inaccessible to the communities they are specifically designed to serve. After years of inactivity and impact from COVID-19, when the industry faced decimating losses due to closures and Marylanders were unable to access the industry's health benefits, we urge you not to compound the impacts of mental and physical health by removing affordable access through this bill. We have prepared an amendment, as mentioned, for your consideration, and we look forward to answering your questions.
Yes, hi. Thank you, Mr. Chairman and committee members. So my name is Mark Miller, and I am the Chief Operating Officer of Merit Clubs in Maryland. We have 9 locations, multi-purpose fitness centers, service about 34,000 members, have about 1,200 employees. And I'm here to kind of tell you a little bit about the opposition to the bill. We're not roller coasters. We're not amusement parks. We are facilities that provide health and wellness. And during COVID, we were regulated. We were constantly regulated. We have health departments that come in on a regular basis. Our slides are inspected. We have fire marshals that come in. All of our employees are certified. We carry AEDs. We do utmost safety. And during COVID, we actually were able to share with the governor and our county executives how we were safe facilities and how we stayed open and had the lowest transmission rate. Again, we're not the trampoline parks and things of that nature. What we provide is a member experience that's onboarding, that focuses on mental health and well-being, that focuses on socialization and community support. And, you know, we're asking for you guys to make this amendment, not to just support us, but to support your constituents, to support the public, right? Because these are public facilities. During COVID, when the city couldn't open up their pools, we stepped in and tried to offer to help them, to train their staff, to give them our safety protocols and all that stuff. Now, that didn't go into effect, but we offered it. And why would they be excluded and not us? Why is it okay for them when you bring your children to those facilities that could potentially endanger them when we take all the safety precautions? We measure things, we do inspections, we do walkthroughs, we have repair and maintenance logs, we keep track of everything in our facilities, and we do the utmost to make sure that members know how to use the equipment through an onboarding process and doing all that. Where when you go to a trampoline park or a roller coaster, they don't teach you how to use the equipment. We do. Thank you for your time.
Hi, Keith Rawlings. My wife Kathy and I appreciate y'all's time and taking a chance to hear our concerns. My wife Kathy and I own the Arena Club. It's an 80,000 square foot facility in Hartford County. We serve, you know, from preschool age to seniors. We have a physical therapy business on site. We take safety very serious. We were just talking about the water slides. We have water slides at our facility. We had contractors out replacing some bands yesterday because the health department came out and said we want those replaced. So we called the manufacturer, got them replaced. Contractors there. I'm the one that climbed in the slide yesterday because I want to make sure there's no metal shavings. I want to make sure that when you go down the slide, there's nothing you hit. So we take it very serious, and through the grace of God, we haven't had any serious injuries. I pray every morning for our pools and protection. You know, the biggest concern is rising costs. I did talk to my insurance provider on the drive down here. We currently have 2 carriers right now that are interested because we have a lot of services. We do flag football, we do indoor turf field, we have basketball. We're full service clubs serving many people. Two carriers have interest in insuring us. We were talking about this bill, and he said, Keith, you're going to be lucky to have one at the end of the day. So I seriously ask you to consider, you know, protect us. We had a member that bent down on as a treadmill 10 years ago as it's moving. She tried tying her shoe, okay, fell off the back. Are we negligent there? No, but we had an attorney sue us and said we were. We had cameras, thank God, that showed that she just, in the middle of working out, she bent over to tie her shoe. So I guess the big thing is you know, the waiver is an issue, I understand, but there's two sides of it, and we really appreciate your consideration of that. Thank you.
All right, we're going to go to the person who's on virtually now, Patrick Connolly. He'll get 2 minutes. I'll ask the two of you to switch on the end here. Just the two on the end, Mr. Pavazza and Mr. Johansson. Ask the two of you to switch. All right, so Patrick Connolly now for 2 minutes, please. If you can hear me. You're on mute, though. You're going to need to unmute yourself. There you go. Off you go.
Mr. Chair, thank you for the opportunity to speak to you in front of your committee today. My name is Patrick Conley. I represent the Self-Esteem and Public Affairs Department, which includes our signature brand, Anytime Fitness. In Maryland, we have 16 franchise owners that represent 20 locations with nearly 14,000 members. Our franchise and small business owners are the true definition of entrepreneurs, taking on greater than normal financial risk to operate their clubs. Their entrepreneurial spirit was evident over the past 3 years, trying to navigate through the unfair times during the pandemic. Our franchise owners not only care about the health and fitness of their members, but the health and well-being of the communities that they opt in. I want to lend our voice in support of IHRSA and the other in front of you today. We are asking for this amendment to nullify the use of liability waivers. Legislation is passed in its current form. It will result in significant frivolous lawsuits and increased insurance costs, adding unnecessary risk to our small business owners that are already taking risks to stay open. We support the request to amend this legislation, specifically exempting the health clubs as defined under the Maryland Code of Common Law, Title 14, Subtitle 12B. Mr. Chair, unfortunately, one of our colleagues in the industry was unable to register for today's hearing, and I wanted to make sure that you're aware that Eric Linseth from Lifetime Fitness is also in support of this amendment. Lifetime has 4 clubs in Maryland with 630 employees and 30,000 members. Mr. Chair, members of the committee, thank you for your time today.
Mr. Johansson, please.
Thank you, Mr. Chairman. I'm Mike Johansson with the Rifkin firm. The proponents didn't talk about what the Maryland courts have really held for the last 150 years, where they've said exculpatory agreements are okay, unless the legislature acts, and we appreciate that's your policy decision, as long as they're unambiguous, and it's not an essential service such as a utility that they're the only provider. It would be unreasonable, unfair for them to require that. But this industry has existed with all the cases and all the problems that apparently have arisen under that same standard, and the courts have repeatedly said it's not void against public policy. What you see here, then, is not us asking for anything. We're not asking for you to pass a bill. We're asking to maintain the same legal standard that's existed in this state for 150 years. The fact that the Virginia courts have seen different, that's their courts that have decided that. Maryland would be in the minority of states, the vast minority, if you legislatively pass this. We have support from the Maryland Association of Counties, the school boards, and MML. They're all exempt from the bill. Sure, they're going to support it. And their actual amendment still allows the individual contractors to have waivers signed on their property. They won't be sued. I'm not sure they were going to be sued to begin with. I'm not sure they ever use waivers. But if they have a football camp at a public high school run by the coaches who are being paid, I assume that's commercial, they can still have all the students sign waivers. Does this bill limit the bar that has a riding bronco? You have a couple beers and you can ride a bronco and you can still sign a waiver, an exculpatory agreement? This is not a complete review, and what we're asking is maintain for us how we've been regulated for the last 150 years. Thank you.
Thank you, Mr. Chair. This question will go to those that actually own clubs, okay? Because I'm a business owner too, so whenever there's something that comes along that I think my costs are going to rise, that enhances my spidey senses, so to speak. So I really want to be careful here and make sure that I understand your business. Do you have waivers now? You do.
Yes,
now,
we're a privately owned club. My wife Kathy and I, we own the Arena Club, and yes, we use waivers now.
Okay, my husband and I are in business together too, so I completely know what that's like. In your waiver, is there a clause that says your client or your member can't sue you if you are negligent?
To my understanding, I don't have that waiver in front of me, because I used the example of the lady bending over as the treadmill's moving. We were sued, so I
Right.
think,
But because you weren't negligent,
correct. And we had videos showing that
Right.
she actually shouldn't have done that. And I guess my fear is if something like this, am I going to be negligent the next time someone bends over as the treadmill is moving? Do I need to have signs saying, please don't tie your shoe when the treadmill is moving or you'll fall off the back? I mean, that's the kind of stuff that I think that you go deeper in this and some examples, and you'll see where we're kind of coming from.
yeah, and I think the way I understand the bill is that it's just that language that would be taken out of the waiver. You still have the opportunity to have a waiver signed, but that language that says you can't sue, you can't waive away my right to sue if the facility is negligent. Is that the way you understand it?
So I think going back to what we were trying to say is, so we've been operating like this way. So Merit Clubs, we've been in existence for 46 years, and we've had waivers this entire time. And sure, we've had our lawsuits, and sometimes they weren't even our things. We had we kicked an individual out because they weren't following the mask mandate that was given by the city mayor, and we asked him to leave the facility, and he sued us for $10,000. And, our concern is that when you change what's already in establishment and already working, what it does is it opens the door for other frivolous lawsuits on every little thing, right? My car got damaged in the parking lot. I bent down on a treadmill, got injured. I reached over and strained myself, and, it does happen, right? And we had a lady who fell off the curb, and she tried to sue the city because the curb height wasn't the right height, yet the city approved all the curb heights. Then she tried to sue us because we put the curb in, and the insurance companies then end up settling, and what ends up happening is all of our premiums go up, and then our costs have to go up, and we end up putting things out of reach for the public to actually improve their health and well-being and their mental health. And so that's why we're just asking for it to stay the way it's always been, because our contracts and our liability waivers that are in our contracts do have to go to the Attorney General's office, and they have approved them for the last 46 years, at least at my clubs.
And one item that I would add there is that if you look at similar states that have done this, you look at New York, which I believe the bill has been amended to reflect as well. We hear from members in the state of New York that since that has gone into place, the insurance companies themselves are not even investigating the issues of when the lawsuits are being brought. They are simply settling and passing that through premiums onto the club owners themselves. So that's where the concern comes. So if you look at the barrier to entry from business operation perspective, you look at the small and medium-sized businesses, you look at the woman that wants to create her lifelong dream of a yoga studio, right? The barrier to entry is already so high for small business owners in the United States and for small business owners in the state that by putting this in, when they go to get those insurance policies to cover their business, to perform their lifelong dream, they're already unable to do so or unable to get insured at that point. That's what we're concerned about, and that's really what we're worried about here today.
Gonna go Grammer, Kaufman, Tolles, Carden, Phillips. Grammer.
Thank you, Mr. Chair. Very briefly. So I have a 2-year-old and a 6-year-old. I've signed these agreements several times. There's a place on 40, 43. There's actually a jungle gym up in White Marsh. I think we're coming to Arena Park next. I also take my kids to playgrounds, public facilities, local county jurisdictions. Mr. Favaza, I think you mentioned the facilities that are excluded from these agreements. But I can't think of another example of a public facility that uses these kind of agreements. Can you?
Well, sure. So I think my concern is the way this bill is drafted. I assume words are intentionally used, and they have to have some sort of meaning, right? So there was a Court of Appeals case, right, about one of these waivers about 10 years ago, and it did discuss this sort of definition of commercial, right? So, and the Court of Appeals speculated and didn't really come to a conclusion about what it meant. And here's a bill that just says commercial, right, without any clarity attached to it. So, you know, a couple of examples. My daughters volunteer at a camp every summer at their church. You have to pay to send your child to this camp, right? It's the Catholic Church. It's the Archdiocese of Baltimore. Is this a commercial enterprise? Maybe, probably, right? Was that intended to be included in this bill or excluded from this bill? I don't know. The Court of Appeals mentioned like the Boy Scouts or the Girl Scouts. Is that included in this bill? I don't know, right? So I think some of these definitions in the bill sort of are inexact, right? And I think raise questions where, you know, we're sort of being, you know, today told this applies to us, and they're being applied to us because these waivers are totally against public policy in every single instance, and it seems like there's some instances, in fact, when this bill is still going to allow them. So that's our concern, is sort of the vagueness of this language. The government exemption is very confusing for a number of reasons. It exempts a lease. Recreational facilities not including unit of state or local government that leases land or facilities to a recreational facility. Well, we sort of know what a recreational facility is from the definition. What if they lease it to a person? What if they lease it to the coach? Hey, you can use the field and you can have the camp.
I get that.
Is
and
that
that's what
clear? Like, I just don't know.
Yeah, and I'm trying to suss that out from you. So, for example, I take my kid to Angel Park up in White Marsh or Perry Hall, whatever it's called now. I'm inclined to say if my kid got hurt there, and it was negligence, I should probably be able to sue. But they don't require me to sign one of these agreements. My kid goes to Rosedale Baptist. They do all kind of services all over the place. They do all kind of activities. I'm never required to sign one of these agreements. And while we might look at the definition and say it's a little wonky, well, I mean, tell me how it needs to be fixed. Like, who else uses these agreements that we need to consider?
Well,
Because that's the question, right? Because I'm a dad, you know, that's kind of how I'm coming at this.
Well, and I think to jump in there, I think one of the examples that we're using are items that are open to the public without agreement to begin with. There is an agreement and assumption of risk upon going to the clubs and using the clubs in general. You go and you sign up as a member. These are not open doors for free public access. Your child cannot walk off the street and jump on a treadmill. These are agreed into contracts with a member service with the assumption of risk in mind.
Okay. All right, thank you.
Thank you, Mr. Chair. And if I'm brief, 2 brief questions. Sure. Thank you. First of all, Mr. Favaza, welcome back to the House. You're a former Chief of Staff to the late Speaker Bush, so it's always nice to see you. Send my regards to your lovely wife. My question, though, is I understand that I understand the anxiety that I'm hearing from your clients, the fitness owners. But I'm afraid I do not really understand it, because you've just heard from I empathize because anxiety is my middle name, but I don't understand the anxiety in this instance, because you just heard them say that that in Virginia they already have this, and I don't read about massive gym closures or so-and-so pool shutting down in Virginia. So why are we so concerned that it's going to be catastrophic in Maryland when it hasn't been in Virginia? And then my second question, sir, is were you guys at the first hearing? Because I must admit, I'm a little bit annoyed because this is the first time I'm hearing from you all, and it's 12 days till sine die. So did you all come to the first hearing and I just was out that day or something?
So, in terms of the hearing, you're right. We weren't here. We're here now. Session is not sine die. So, yes, in a perfect world, we would have been here sooner. And we're very grateful to the chairman for granting us the courtesy of a hearing today so we could express our concerns on the bill.
Virginia.
Oh, in terms of Virginia, look, I think as Mr. Johansson pointed out, this has been long settled law in the state of Maryland for generations. And businesses here in Maryland, when they're making these investments, made these investments based on a certain set of assumptions, right? In terms of what their sort of ongoing, costs of doing their business will be. So, different states do things differently. Business owners go into business with their eyes wide open and figure out how to manage those costs and how to manage their business. This is a dramatic change in Maryland law that's taking place. And as I pointed out, the bill is imprecise, to put it mildly. And we just urge the committee to take a careful look at our amendment and carefully go back and look at this bill and really think about, is it doing what you intend it to do?
And if I may jump in, one item that I would add is that there's a real-time example of this going on right now in the state of Oregon, where the courts have nullified the use of these waivers for all outdoor and indoor recreation. As they've proceeded this throughout the year, over the past year and a half or so, there have been outdoor recreations that have ceased to exist, clubs that have began to close, and groups that have begun to just shut their doors because the cost of liability insurance and the cost of interacting with the lawsuits that have come through is too high and too great of a risk. So I would caution as well to please take a look at what's going on in Oregon and the work that's going on there as well.
Judge, we'll just agree to disagree because the sky hasn't fallen in Virginia, but I thank you all.
Thank you so much, Mr. Chair. Thank you all for being here. I will admit I am a co-sponsor added on during our House hearing because I think this is a wonderful bill. So I will come to you with some questions where I am in a friendly disagreement. And so I have a rhetorical question and a non-rhetorical question.
Will we be able to tell which is which?
Probably not with me. Right. So the rhetorical question is, do you agree that our fitness centers are essential to our lives?
I would answer that with a resounding yes, and I think we proved that during COVID.
So the gentleman right here said that when you have a utility service and other services, they are essential to your life. So they can't make you sign a waiver to say, hey, for whatever reason, for utility or other essential services, the court doesn't make you sign a waiver.
Correct.
So if this gentleman that's on your panel agree that's essential, then you should not need to sign our consumers should be able to not have to feel like they can move about, enjoy your health clubs or any other facilities that you're here representing without any type of waiver.
It's actually a great question. Thank you. So when the court used the phrase essential services and they mentioned a utility, what they're talking about is a consumer doesn't have choice. So, for example, if you have an electric utility
So
that
let me
serves
back
your
up
house.
and say, I know what you mean. I have a
Correct.
little legal background.
Correct.
So I don't kind of need that. But that was the non-rhetorical question.
Okay.
I mean, I'm sorry, that was the rhetorical question.
Okay.
Confusing
Thank you.
myself here. So the other question I have is a more sort of process question. Can any of you all explain to me what is the process? What is your normal sort of course of business for having inspections done? Are they pop-up inspections? Are they inspections that, it's once a month, it's 30 days? And I want to know, you have a small business, which is great, but also for your business and also for the bigger chains, like a Planet Fitness, LA Fitness, or whatever, do they do pop-up inspections? Is it planned inspections? What is the process for that to occur?
So every year, we run a very large summer camp. We average about 250 to 300 kids a week. And we are regulated by the health department of Harper County. So they'll come in and they'll look at our facilities. They will go through, all of our emergency procedures. We do get random visits by the fire marshal, just going through the facility, making sure push bars are working, alarm systems are operational. So our inspections, happen a lot. The health department, we're in a situation where we're also monitored because we're on a private water system. So our water is monitored, our discharge of our septic system is monitored. So we have a lot of contact with, regulations of what we do at our facility.
We are very much the same way. So all of our summer camps are state accredited, and so we have to go through an entire inspection process, and it's random. It's surprise during the middle of the season. We have to put all of our waivers, liabilities, everything into it so that they can see it, they can inspect it. Sometimes they come twice a season. We also have AEDs that we check daily, have a whole inspection log, and then they get inspected as well. The fire marshal shows up when they want to show up. They're random. Same thing with the health department, the liquor board, any of those types of things. We have no recollection of when they're coming, and they just kind of walk into the facility and the inspection happens. And then we get a report, and obviously, if there's anything of issues and all that, we have to rectify it immediately in the moment. We also have a preventative maintenance team that we ourselves take inspection to the next level, where we use a Connect 2 platform, and each shift we have a manager on duty that is doing shift reports where we log everything. So if a dryer breaks down, if there was a kid that got injured, we do an incident report. We do all different things and everything. And then in addition to that, we do run code Atom drills. We have active shooter programs and all those things so that we take safety as the utmost priority.
But would you agree that there are chances or situations where you could have a treadmill that the tread is not as strong as it should be, or, some other, situations going on with the equipment? Do you agree that that is a possibility? We heard from the previous panel that there was a case, I think Mr. Boston indicated that he had with the client that obviously had some issues with the machines. Do you agree that you all are just, stellar pillars of the community, but you could have situations where that occur? Do you think it's fair that, I will be unapologetic about, I am really concerned about those individuals who cannot afford to have representation and be able to afford an attorney or take the time to sue if something does go wrong. So they just have to sort of deal with whatever situation that unfortunately happens to them. So do you agree that there are situations that could occur with equipment?
I think situations can occur in anything. Delicate Graham over here, when his child is on the swing could break at a public playground, and he could get injured and end up suing the child, right? When you go in for surgery and you sign a liability waiver for surgery, that's essential, and something goes wrong, a malfunction of a machine and all that. So yes, anything can happen to any of us at any moment in our lives.
I think where the question comes down to is with the writing of the bill as it currently stands. As Mark mentioned, those items can happen, and they go through, and you heard the processes that they go through to ensure that they don't internally, and that they work to in the inspections that they go through from the state themselves. What we're afraid of is because of the ambiguity in the bill, that when these situations do arise, because of the drafting of the bill and because of passage of the bill, it will eliminate even the inspection and investigation as to if that negligence even exists. It will immediately cause settlement from the insurance companies, and those premiums will be passed on to the business owners, as I said. As I mentioned earlier, right, there's a lot of folks that can afford and will be, they'll afford the riders, they'll afford the increase, they'll afford. It's those small business owners, it is those ones that, to your point as well, don't have the same voices, that are still trying to operate their businesses in a safe and sound way, that are going to be unable to do so.
Okay. Thank you, Mr. Chair.
Thank you, Mr. Chair. Thank you. Thank you to the panel very much for coming. As a former member of Merit, and Merit used to have a place right on Amarillo Drive right down here. I don't think it's there anymore, but I used to go there every session. So you guys run a great ship, so keep up the good work.
Thank you.
It's always, I used to see Mr. Johansson and Mr. Favazza in Ways and Means quite a bit. I don't see you guys in Judiciary, so it's good to see you guys. So I think this is probably for you guys on government relations side, but maybe if the members want to talk. Is it my understanding that you're not opposed to the idea, the concept, it's more about the language of the bill, that this language that says that you should be, your limit or indemnify or hold harmless any facility for liability or injury that's caused or resulted from the negligence or other wrongful act of the facility. Is it your testimony that you are against that language and that concept of avoiding liability for a wrongful or negligent act of the facility? Or is it, so let me ask that. I don't want to get too compound.
We oppose the provision, that provision being applicable to registered health clubs.
Okay, so if there's a wrongful, if a facility manager winds up miscalibrating a machine because this person's a real jerk and they don't like this member and they wanted to give them extra weight and the machine winds up falling on them, the facility shouldn't be liable for that?
If that's an intentional tort, is that negligence, or is that something that you can't, waive anyway?
So,
what you seem to describe was an intentional tort.
Okay, so if the facility manager forgot or didn't turn the air conditioning down at night, and therefore the machines that were required to be at a low temperature were too high, therefore the oil melted and the machine broke down.
Correct.
So that's the fault. It's negligence. It's not intentional.
We would agree with the Maryland courts for the last 150 years that an adult can sign that release of negligence, and we would proffer that to them and see if they sign it. If they don't choose to sign it, they may go to a gym across the street that may not require them to do it. There are obviously a lot of gyms in a lot of neighborhoods. There's plenty of competition out there, and if someone wanted to hold themselves out as saying, we don't require you to waive negligence, they'd be able to do it. Under this bill, none of the clubs would be able to maintain the practices that they've safely maintained for the last 150 years.
But assuming that they don't perform negligent activities and they actually keep up to speed, as the gentleman from Merit was talking about how and the gentleman from the Arena Club, I don't think these are the facilities that are going to worry about this because they seem to keep everything up very, very high quality. The question is, if you're negligent in how you uphold you want to protect people who are negligent in how they uphold their facility. And that is the concern. I'll give you my final example, Mr. Chair. 11:30, we had an hour break. We didn't have to be here till 1. I ran to the gym and ran on the treadmill for an hour. I happen to have done that. If I overexerted myself and hurt myself and fell off the treadmill, I understand. I took the assumption of risk. It was my contributory negligence, and I can't sue. But if I'm running on that treadmill, and all of a sudden the ceiling falls down on me, you're saying because I signed an exculpatory waiver, I shouldn't be able to get the gym doesn't want to negotiate a settlement with me because they injured me?
They may. Mr. Boston, in fact, said even with a waiver, he was able to negotiate a settlement. Okay? No one is prohibiting anyone from suing under these current waiver agreements. You can sue, and perhaps you'll allege that the equipment was defective and sue the manufacturer of the equipment as well. Perhaps you'll allege there was gross negligence. Okay? If you allege simple negligence, the court's going to tell you that you signed a release of that if the release was worded unambiguously and isn't for some other reason void for policy. So yes, it limits the number of cases that are likely brought, limits the number of settlements. but it doesn't say that you can't sue and seek a settlement for convenience, reputation, whatever that club would be willing to settle for.
All right. Mr. Chair, I'll just say, Mr. Vavaza, if there's ambiguities that you think need to be corrected, you should certainly, I'm happy to talk to you, but I appreciate you guys here.
Thank you.
Thank you, Mr. Chair. Thank you guys for being here. I just wanted to the gentleman who mentioned Oregon. That case was quite unusual in that Oregon, as you probably know, doesn't have assumption of risk in their state law at all. It's like the only state in the nation. So that case was like a dirt bike or some kind of, and the person in the state of Maryland, had that occurred, would not be eligible for any type of compensation, even if this bill passed, because he was clearly contributing to the outcome of that situation. So I just want to make sure that the situation where places were closing down and they couldn't get insurance was because they lacked something. And Maryland has it. We reaffirmed it recently in 2009.
Yeah, and I thank you for that, and I appreciate the opportunity to clarify. What I was using that as an example of is similar areas where the liability waivers are no longer in place. And I'm not talking about the parks with the dirt bikes. I'm not talking about those recreations themselves. What I'm talking about is the fitness and health facilities within that state that are now unable to get the startup insurance policies, that aren't able to operate the way they used to operate because of that negligence, which goes to the conversation around this bill and the ambiguity about who's covered, and looking back on to your mention here, right? A fitness center in this building is exempt in this bill.
I don't see where that's true. Could you be
From
more
the
specific?
state policy, and we'll follow up.
Yeah, I would love to see, because I just don't
You would be,
see-
they would, the state facility themselves would be able to ask you to sign a waiver based on this bill.
They can't ask us to sign a waiver. They don't. Like, I haven't signed a waiver here. There's a gym in this building. We haven't signed
But
any waiver.
that's our concern is that unfair competition, and if you look again to those small businesses and those who are trying to get the policies, that will no longer be able to afford them.
There is no competition between what you guys offer and the Senate gym. Let me just tell you that for sure. And I'll just add that Oregon has a bill right now to remedy the situation. I mean, obviously ours was established through case law, but they are immediately trying to remedy this so that all of their businesses can immediately get insurance, and they're probably going to model it off of what already exists in states like Maryland. So, thank you.
Thank you, Mr. Chair. My question had to do with Oregon too, but I think Delegate Arcand really hit it. So if y'all could just provide the committee with whatever the case is and any analysis you have, we would appreciate that, because I'm not respectfully going to go looking for it. Thank you, Mr. Chair.
All right. Thank you all very much. That concludes the testimony.